I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe Esposito here. I am so glad that you're there. Because what we're going to talk about today is something we all suffer with, and that's pain. What causes your pain? What are the things that you're doing to make your problem worse? Now, I've been in practice about 35 years now, 36 years. I just saw I had an anniversary. 36 years now, and we deal with pain patients all day, every day. We have 4 offices, pain patients in and out the door constantly. So we as chiropractors, I'm also board certified, like I said, orthopedics, pain management, I'm board certified nutrition. So a lot of tough cases end up in our laps. A lot of times doctors, hospitals have given up on a lot of patients and we don't know what else to do. Go see Joe and his clan, see if they can help you. In most cases, we can. So what we try to do is get to the cause of your problem and not just treat the symptoms. And as I was talking to Garrett about this show, I thought, I've never done a show on what things you're doing that can be causing pain. In all the years we've been, a decade or more we've been on the air, never did a show like this. So this is going to be a fun show. So there are things that you're doing every single day that can make your pain worse and you don't even realize it. And that's what we're going to cover today. So that you can go, aha, you're right, Dr. Joe. That is something that I do or that I wear or that I sleep on. And boy, you're absolutely right. I never thought that that could be it. And we get that all day, every day in our offices. We go over healthcare with patients and they always said, never looked at it like that before. In fact, just this week, one day we had 2 doctors and 3 nurses come in as patients. And when I explain things to them, they always say the same thing. They go, I never thought of it like that before. It's pretty cool. So let's jump right into it. Reasons why you're in pain. Number 1 is shoes. Now, this is important because we blame our pain on a lot of different things. But Cleveland Clinic in Florida, he had some examples, this guy, David Westerhall. Flip-flops and foam-soled sandals. These can cause a lot of problems because they don't give you good support. They don't give you a lot of arch support. That can lead to pain in your feet, which can lead to pain in your ankles, which can lead to pain in your knees, which can go to your hips. So I get this question about once a week. And they'll say, Dr. Joe, I have plantar fasciitis, I have bunions, I have bone spurs in my feet. What supplement can I take for that? Well, the problem with that is that that's not a supplement issue. That's a structural issue. And I believe the missing link in healthcare, and I've talked about this in the past, I believe the missing link in healthcare is that we're missing the structure when it comes to healthcare. We try to treat everything chemically. What pill can I take? Even what supplement can I take? What cream can I use? What lotion? What topical pain management can I use? But many times the problem is structural. So what that means is, you have 206 bones in your body. Any one of them can come out of place. And if they come out of place, that can cause a cascade effect and shift everything above and below it. So with the feet, if you have bone spurs, plantar fasciitis, bunions, the bones are out of place. Every case I've ever seen, this is what's happened. The bones in the foot move out of place. 1/4 of all the bones in your body are in your feet. So if the bones move out of place, that causes you to walk a little crooked. That can put stress on your knees. The knees then can put stress on the hips, which can put stress on the low back. Now in the low back, if we pinch a nerve in the low back, those nerves control your hips, knees, and feet. So we may have to go in there and adjust the feet, put the bones back in place to take the stress off the knees and stress off the hips and open up the nerve supply back to the foot. So you've got this little cycle going on back and forth. So many times if you have bad shoes, that can cause issues. Now, when I was a kid, we were really poor. So you had dress shoes. When the dress shoes got old, they became your play shoes. We never had sneakers. And I remember playing football in the street or hockey in the street in dress shoes. And you'd slide across the pavement. And many, many, many times I twist my ankle. And so over the years, I did a lot of ankle damage. Then I played football. Then I played hockey. Weak ankles, kept spraining my ankle. Well, that led to problems with my knees, which led to problems with my low back. Finally, when I realized that it was a chiropractic case, I didn't realize that when I was a kid, I got chiropractic care and I had to work from the low back down and from the bottom up. I had to get my feet adjusted, my knees adjusted. I still have to get my feet and knees adjusted. Because when I was young, I kept twisting them out of place. I stretched the ligaments. Now, ligaments hold bones together, and ligaments are like rubber bands. If you have a brand new rubber band and you stretch it, it never goes back to its original form. And each time you stretch it, it gets weaker and weaker. That's exactly what happens to your ligaments, happened to my ligaments. And so because of that, I had structural issues that it took me years to get stable. Now, had I been smart when I was young and had good shoes when I was running and playing, I wouldn't have had all these problems to begin with. And so they just kind of snowballed. So your shoes are really important. You want to get really good shoes. I had the darndest time trying to find shoes. I liked Merrell's for a long time, and then I found Skechers, and they're so light, and I love them. The problem is the Skechers kind of wear out a little bit quicker than other shoes, but those are the kind I like. Now, I have no affiliation with any of these shoe companies. This is just what I found to be the best. They're light, they're easy to wear, and you can hike in them. So you want to make sure you get a really good shoe. When a shoe starts to wear out, get a new one. You can put insoles in them, and you can try to get different shoelaces, whatever it is. If the shoe's wearing out, the shoe's wearing out. It's time to get new shoes. So I have no problem with that in getting new shoes because it's worth it to me. And I like to be comfortable. So same thing with dress shoes. It took me a long time to find dress shoes that looked nice, but had rubber soles on the bottom. And so when I finally found them, I was pretty happy with that too. And so it's really important that you wear the right shoes, and things like flip-flops, not a good idea. Shoes that don't fit, not a good idea. Try to get shoes that fit. Don't try to. Get shoes that fit properly. It's going to save you a lot of money and pain in the long run, and probably even save on your chiropractic bills because you won't have to come see us so much. So we're talking today about reasons you're in pain, and you may have never thought about it. But we'll go back to shoes. God, I can beat the heck out of shoes here. Look at your heels. If the heels are wearing unevenly, something's not right. Now, you can buy new shoes, but what's going to happen is if, let's say, your left heel wears out more than your right, it's going to happen again and again. That's telling you that you have bones out of place in either your hips, your feet, your ankles, your low back. The bones are out of place, and when you're walking, you're not hitting the ground equally. And so that can cause the shoes to wear out. So look at these things. This is a warning sign. This is telling you something's wrong structurally. I need to go see Dr. Joe and his team, or certainly a qualified chiropractor. But of course, I think I'm a little biased. I think we're the best. So you can get in and get that fixed. And many cases when we do that, patients say, my shoes don't fit me right anymore. They start a chiropractic care with us, and the shoes don't fit right anymore. Why is that? Because now the feet are balanced, and you used to having them off balance. So actually, it's right, but you think it's wrong because you're used to it being wrong. So look at your shoes. Use those things as a warning sign. I always say look for the warning signs. Get to the cause of the problem. The shoe wearing out is not the issue. You don't need new shoes. You may have to fix your back. Then the shoes won't wear out unevenly. So always get to the cause. Don't just treat the symptoms. Smartphones. This can cause pain. Now, I am not a fan of smartphones. I use them, of course. We all do. But what happens is smartphones have something called electromagnetic frequencies, EMFs. And when you have EMFs close to your body, they change the cell structure. The cell has a wall around it. And in the wall has a calcium channel. It's a lot of different openings, tons and tons of different openings. But one of the openings is called the calcium channel. And it allows some calcium into the cell. What happens is electromagnetic frequencies can open up these calcium channels. And you get this flood of calcium into the cell. When that happens, this calcium that's in the cell, excessive amounts, causes free radicals to form. Free radicals are like Pac-Man. They eat through things. Waka, 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 waka. And so they're eating through things. So when you open up this calcium gate and you dump all this calcium into the cell, it creates free radicals. Free radicals can now eat away or damage the inner workings of the cell, the DNA, the RNA, the mitochondria, the cytoplasm. And so it's eating away at these things, and it can cause some real serious damage. The big challenge we have is near the heart. If you have electromagnetic frequencies near the heart, it can open up these calcium channels, and it can change the heart cells. We have seen studies where if you have electromagnetic frequency near the testicles, it can change sperm production. So I strongly advise that if you have a cell phone, which you probably do, try not to carry it in your front pocket or in your front vest. Or women, don't put it in your bra because it's going to cause more damage. Now, I try to, when I get in my car, I take my cell phone out. When I get home, I put my cell phone on the other side of the room. I try to stay away from my cell phone as much as possible, but that's not possible. if you're going to be part of society, because you have to have your cell phone with you. You're walking, you got to carry it with you. So if I walk, I try to carry it in my hand. If I do put it anywhere, I put it in my back pocket. This way it's a little further away from my reproductive organs. But this can cause pain. And so we now know that if you put the cell phone next to your head, and there's been studies out this for years, it can heat up the cells in your brain. And we don't recommend using your cell phone touching your ear. And in fact, I know that's not silly, touching your ear. Of course I have my cell phone touching my ear. Read that little packet of instructions that came with your cell phone. The one you never read, the one I don't think anybody ever read. It clearly says, do not put this cell phone next to your ear. Hold it a few inches or a few millimeters or a few centimeters away from your ear. No one's ever read that. But it says it right there in the directions. Why? Because electromagnetic frequencies can actually heat up the cells in the brain, and the thinner your skull, the more damage occurs. Who has a thin skull? Children. Now, there's a Moody Blues song, and I've quoted this song many times, and one of the lines in the song is, "And I'm frightened for your children." And I'm very frightened for our children because they are living a very different world that we lived in. It was weird enough when we had cell phones. It was weird enough when kids are online. Now kids are in lockdown. They're not going to school. We see issues with suicide among children skyrocketing because they're getting depressed. Because where you and I lived a social life in high school, you had friends, you went to events, you may have played sports, you dated, you did these things in high school. These kids aren't doing that now due to this lockdown. And so what are they doing? They're spending all their time with their best friend, their cell phone. And where are they putting it? They're putting it next to their head when they go to sleep at night. They're constantly on their cell phones. They're staring close to the screens. So I don't know what this is going to do, but I don't like it. So cell phones can actually cause pain. So I'll tell you anecdotal stories. Many times patients will come in and say, "Dr. Joe, I got this right hip pain, and you guys are doing amazing work with it, but it's just not going away. The right hip pain is just hanging on, and I don't know why." And I'll look around, and I'll see if they carry their cell phone in their right hip pocket. And I'll say, "All right, what I want you to do is switch it to your left hip pocket." In many cases, within a week or two, they come back and say, "You know what, doc, you guys are miracle workers. That right hip pain is finally gone. But you know what? My left hip is starting to hurt now." So think about this. Where you carry your cell phone, do you have pain there? It can cause headaches. It can heat up the cells in the brain. Not a good idea. If you put it in your front pocket for men and women, it can affect the reproductive organs. Women put it in your breast, or you put it, gentlemen, your jacket pockets or your shirt pockets. Don't put it near your heart because electromagnetic frequencies changes the calcium channels, and that can cause some real serious problems, and that could be a cause of your pain. Every morning when I wake up, Dr. Joe, I have a headache. Okay? We check them out chiropractically. We check them out orthopedically. We have a medical doctor on staff. We might do a medical evaluation, get an MRI, get a CAT scan, do x-rays. Every night, Dr. Joe, I get a headache. Okay, where do you put your cell phone? Well, I read my cell phone as I'm falling asleep, and then I fall asleep. It's right next to me. Get your cell phone on the other side of the room. In many cases, headaches are gone. So different people have different sensitivities to their cell phones. So your cell phone could be the reason why you're having problems. So try to stay away from your cell phone. I know that's a hard thing to say, as far as you can. At night, you have Wi-Fi in your house. I'm assuming you do. I recommend you shut it off. And the reason is that Wi-Fi is just traveling through the air constantly. At least give your body a break from all that Wi-Fi. You can buy a timer. They use them on Christmas trees. I think they're like $8 or $9 at the big box stores, maybe $10. And you can set your timer and say, okay, I want the timer to shut off my Wi-Fi at 11 o'clock. I want to come back on again at 6 o'clock, whatever hours work for you. It's just another step. Is it going to make a difference? I don't know. Is it worth $8, $9? Absolutely yes. So that's a good idea too, is shut off the Wi-Fi at night if you can. Get your cell phone far away. Think about where your pain is and see if your cell phone is near there. And if it is, we will say once again, Dr. Joe was right. Dr. Joe's usually right. Kind of goes along with the same thing. This before cell phones, I had a problem with patients with wallets. You take your wallet, you stick it in your back pocket, and you have shooting pain down that leg. So what are you doing? You're sitting on that wallet and you're pushing on your hip. Now, that's a chiropractic adjustment. We use something called blocks. And blocks look like wedges, and you can put them underneath people's hips in certain positions, and it can slowly rotate the hips back into place. Same thing happens with a wallet, only it's not putting the hip back in place, it's pushing the hip out of place. And so if you're sitting on a wallet and you have back pain, get rid of the wallet. Now, the fatter the wallet, the worse it is. But you're thinking to yourself, but Dr. Joe, I have no place to put my driver's license or my credit cards. So get a thin wallet. The thinnest wallet you can possibly get, and carry as little as possible with you. Now, if you wear a jacket or you have a shirt pocket, you can always put it in your shirt pocket. That's fine, because again, there's no electromagnetic frequencies with a wallet. So the cell phone electromagnetic frequencies, that's an issue. The wallet is more structural. It's just pushing on things. So maybe put it in your front pocket. That's what I do with my wallet. I carry it in my front pocket, and it's real thin. So try to get that wallet out of the way, because it's putting a lot of stress on your body. And again, as a chiropractor and a pain management expert, I want to give you as many tips as I can to get to the cause of your pain, not just treat the symptoms. Now, let's assume you go through all these things that we're going to teach you today. It's not fixing it. Or you've had pain for a long time. You've had pain for a day or two. I would like to see you as a patient. I would like for you to come see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. Now, I can't be in all offices, of course, but all my doctors are handpicked by me. They're trained by me. And they truly are, in my opinion, the superstar all-star team of doctors. If there was a healthcare Olympics, we would win, hands down. Healthcare Super Bowl, we would win hands down, in my opinion. We have medical care as well. So if you need an injection, if you need an ablation, which is we actually damage and burn a nerve, it's called a median branch nerve, to try to kill that nerve. It grows back, but you can at least calm it down so we can get in there and do better chiropractic adjustments with you. So if you have neck pain, back pain, shoulder pain, stop suffering. Just make an appointment to come see us. You can do it right online, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We accept most insurances, car accidents. Oh gosh, folks, please. If you've ever been in a car accident, if the car was damaged, you were damaged. I've never, in my 36 years of practice, saw somebody walk away from a damaged car that didn't have damage to themselves. You are not stronger than steel or plastic, whatever your car is made out of. You're not stronger than that. So come see us as quickly as possible, because the longer you wait with car accidents, the more likely the insurance company is to give you a hard time. You could be 100% right. And Dr. Joe, I'm right. I didn't cause the accident. I know that. The insurance company will do everything they can to make sure that they pay as little as possible. And so sometimes that's even accusing you of things you didn't do. And I've seen that hundreds of times. So come see us as quickly as possible. If you have other issues, just come see us. You can book it right online. Normally, the first visit is $375. Through COVID, we've reduced that to $199. What does that include? An examination, a consultation, x-rays, your first chiropractic treatment, the next visit going over your x-rays, and the nutrition evaluation. The nutrition evaluation alone is $150. So you're silly not to take advantage of this. And the biggest complaint I get is, why didn't I do this sooner? Why did I wait so long? And every day that goes by, your problem's just getting worse and worse in most cases. drjoe.com. You can book right online or call us. There's a number there, and you can call us and get that set up. And again, we do accept insurance for treatments after that. We even take Medicare. How cool is that? We have medical services. We have PRP. PRP is taking your own blood cells, your platelets, spinning them down in a centrifuge, and then putting them back into your body in a concentrated form. So for knee arthritis, shoulder arthritis, any arthritis, PRP is amazing. It's great for hair replacement. You actually inject your own cells back into the scalp, and you can grow hair with it. Erectile dysfunction, urinary leakage in women, sexual dysfunction in women. PRP is crazy. So we have a lot of services. I won't go into that. Go to our website, drjoe.com. There's a drop down. It says services, and you see everything we have to offer. Weight loss programs. We want to be your doctors. So you can do it right online, drjoe.com. So we're talking today about why are you in pain? What are the things you're doing that are causing pain? How many people drive a lot? Driving is so bad for your back. I remember years ago, a big power company right around my office, they hired me to come in as a consultant. And I went in, and they were talking about how many missed days they had with back injuries. Cold and flu is the number one reason people miss work. Back pain is number two. And I said, Dr. Joe, we got to do something. We're losing so much time and manpower with people missing work but back pain. So I interviewed the drivers. I met with them. We had a nice conversation. I said, can I go look at your trucks? Sure. Jump up in a truck. I sit down. My butt just sunk. Every truck I sat in, the seats were worn out. Nobody ever thought that the seats were worn out. They just thought that the guys were out on the poles climbing. That wasn't it. It was the bad seats they had in the trucks. So I recommended you can buy seat cushions, and I recommended some seat cushions. And I went back a few months later, and I said, how's it going? They said, almost no days off. Everyone's feeling so much better. Quick, easy, inexpensive fix. But driving's not good for you to begin with. If you have a bad seat, even worse. So driving pulls your head way away from the headrest because we all lean forward when we drive. I do too. So what you want to do is when you're driving, try to push your back of your skull against your headrest. And in fact, that's an exercise we give out patients many times, is just take your chin and as if you're driving your chin toward the back of your neck and just push your head against the headrest. And every time you come to a red light, I want you to do that 10 times. And what that's doing is it's strengthening your neck muscles and reminding you to bring your head up forward. I'm as guilty as you are. We all have bad driving habits. But this could be the reason why you're having so much pain. Sometimes neck pain, sometimes back pain. It depends. Another issue that I've seen, again, I've been doing this for 36 years, another thing I'm seeing now is video game issues. People are hurting themselves playing video games because it's real live action and they get real excited and they get really into it. And you can actually hurt yourself playing video games. Because first of all, you're probably slouched over, you're not sitting well, maybe sitting on the edge of the couch, you're leaning back, you don't have good ergonomic posture. Then you're getting all excited and you can jerk your body, jerk your head, and that can cause problems. And we see it a lot. Kids come in, usually kids, but now we're seeing adults too. Coming in, what'd you do? Nothing, Dr. Joe. I did nothing. I don't know why my neck hurts. Okay, let's talk about your lifestyle. I hardly do anything. I don't lift weights. I don't work out. I don't do gardening. I like to sit around and play video games. Okay, let's talk about the video games. So video games can actually be a trauma, and that can cause injury to your body. So start thinking, and I always teach people this. Think about why, when you have the pain. And many times I have people write down what they eat, which I'll cover in the next half of the show. We'll talk about foods that can cause pain. But I'll see them and I'll say, start writing down what you eat and then write down when you have a pain. And then I'll have to look at that and say, okay, what else did you do? Well, I wasn't doing anything, Dr. Joe. It was Friday night. My friends were over. We were playing video games. There you go. Okay? So these are things that you may not realize are causing the pain, and they are. Now, if a bone is out of place, that's usually cause of the pain. Something is inflamed, and that puts pressure on a nerve. But here's the thing. 90% of your nerves don't feel pain. You can have a pinched nerve and not know it. 90% of the time. So, for example, you don't feel your blood pressure. It's controlled by nerves. You don't feel your spleen, your kidneys, your adrenal glands, your hair grow, all controlled by nerves. So in our offices, not only do we check the nerves that feel pain, we can check the 90% of the nerves that don't feel pain. And the reason is if we take you on as a patient, I don't want to get you out of pain. I want to get you well. There's a big difference. I can give you medication, which will make you dopey, but you'll be out of pain. Or we can get to the cause of the problem, and hopefully you don't need the medication. I was just talking to some students, because I do a lot of workshops with students and other doctors, and I was saying non-steroidal anti-inflammatories, over-the-counter painkillers. Did you know that they can affect testosterone production by affecting the testicles in men? So if you're taking over-the-counter painkillers, you don't think anything about it. I feel good, I'll take this, no big deal. It can actually affect your testosterone. And testosterone is not just your sperm, it's not just your sex drive hormone, but you need testosterone to build muscle. Not just biceps and triceps. How about your heart? How about your colon? How about your blood vessels? These are all muscles as well. So if testosterone drops, it becomes a big issue. So folks, I'm Dr. Joe Esposito. Tell your friends about the show. Follow us on Facebook and Instagram. Very important. You got to do this. At Dr. Joe Esposito. We post almost every day at Dr. Joe Esposito. The website, drjoe.com. Tell your friends about the show. Thanks for tuning in. We'll catch you next week. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.